this presentation, we'll be going over APRV mode description, set point terminology, patient selection, initial settings, optimization of settings, and a conclusion. APRV myths. You can only apply APRV with a Draeger Avita ventilator. Another myth, the Avita ventilator has a superior exhalation valve. The first myth, few practitioners claim that APRV can only be applied with Draeger ventilators. Conversely, there are various machines that can replicate APRV. Yes, APRV is a trade name for airway pressure release ventilation on Draeger brand ventilators. However, one must think of APRV as a specific application of biphasic breath delivery and not solely focus on the name of the modality. Now, exhalation valve design. Pictured is a floating exhalation valve from a Avita ventilator, and with this design it allows for unhindered spontaneous breathing during airway pressure release ventilation. The valve prevents the ventilator from terminating the inspiratory phase and losing mean airway pressure during patient activity, coughing, or exhalation. Now, each manufacturer has a different design of exhalation valve. However, researchers reveal no statistical differences when comparing the Avita XL, the Puritan Bennett 840, and the Servo I ventilator in regards to the ease of the pressure release and pressure overshooting. However, when evaluating expiratory resistance, one bench study discovered that the Avita XL had the highest expiratory resistance. Currently, there has been no studies on patient comfort or interaction with expiratory valves. Can we justify APRV? When applying a new therapeutic, we should ask questions first. Is it needed? Is it logical? Does it work? Is it safe? Is it an improvement? And is it cost effective? Is APRV needed? Is currently the methods inadequate? Now, some medical practitioners argue that APRV is superior to traditional ventilator strategies. For example, the ARDS low tidal volume strategy for patients with ARDS. However, no clinical trial to date have shown any meaningful clinical outcome benefit over conventional strategies. Is it logical? APRV is 2 levels of CPAP. It's very logical. Does it work? Yes, it works. Is APRV safe? If applied correctly, it is a safe mode of ventilation, which has been in practice for over 20 years. Is it an improvement? Well, there's been no clinical studies showing that it is better than traditional ventilator modes. However, the expiratory valve is an improvement. It allows for unhindered spontaneous breathing. However, this valve is active in other modes of ventilation also. And lastly, is APRV cost effective? And that's one to decide on if the mode of ventilation is already in the current machine. How long does it take the staff to be familiar with and apply APRV safely and appropriately, and all the training involved with that. The manufacturer's names for APRV. As mentioned before, APRV is the trade name for Avita series ventilators by Draeger. So all terminology described in this presentation will be based on this platform. This is bi-level ventilation, the mode on the Puritan Bennett 840 used to mimic APRV. This is bivent, the mode on the McKay Servo I ventilator used to simulate APRV. And these are waveforms from the Hamilton Galileo. The mode is named DualPAP Plus, and this mode most resembles APRV in regards to the names of their settings, the initial settings, and optimizing settings. And DualPAP Plus is seen on Hamilton ventilators. Modality description. APRV has been described as a time-triggered pressure limited time cycled ventilation mode. APRV provides two levels of CPAP, a P high phase and a P low phase, during two set time periods, a T high and a T low. Additionally, the ventilator has a release valve that allows for unhindered spontaneous breathing during both the T high and T low phase. This is also known as biphasic ventilation. As you see pictured, you have spontaneous breathing on the inspiratory phase also. Additionally, we can classify the APRV by its breathing pattern. We can look at the primary breath control variable and breath sequence. When classifying APRV based on the breathing pattern, APRV is classified as pressure controlled, intermittent, mandatory ventilation with an active exhalation valve. So here's APRV, and we have a time setting. So we have mandatory breaths at every 6 seconds shown in this picture and shown in the waveform also. So we know that it is pressure limited, or it's pressure controlled, and we have mandatory breaths. However, to differentiate between CMV and IMV, we need to look if spontaneous breaths are allowed between the mandatory breaths. Now here's the normal inspiratory time during APRV, and what has happened here was decreased to a conventional I time, for example 1 second. And if we look at the waveform, that here's our mandatory breaths shown in the pressure waveform, this blue waveform, the dark blue breaths. And if we look at the flow waveform underneath, we notice that between the mandatory breaths we have these spontaneous breaths. So spontaneous breaths are allowed in between the mandatory breaths. So this distinguishes APRV as a IMV mode. Last thing we want to look at is if APRV uses a floating exhalation valve or active exhalation valve, and we can see this if spontaneous breaths are allowed within mandatory breaths. So here are our mandatory breath phases, and as you can see we have spontaneous breaths as evidenced by my flow